New York City Health and Hospitals Capital Committee. Today's meeting is officially called to order. Please note, for the record, Dr. Theodore Long is representing Dr. Mitchell Katz, Erin Kelly is representing Susan Miles Gustav, and Karen St. Hilaire is representing Molly Wasso Park, all in a voting capacity. I would like to propose a motion to adopt the minutes of the Capital Committee meeting held on April 8th, 2025. All in favor, please say yes.
Yes.
Opposed, say no. So the motion is adopted. Next, we will hear the Vice President's report, Mr. Saiz.
Thank you. Good morning, everyone. Essential infrastructure and clinical renovation projects throughout our system, which is what I'll be representing in this report. New York City Health and Hospitals, Queens, we have recently completed the end building cooling project, which includes the replacement of 2 air handler units for the data rooms for the hospital. This is critical for the operations of Queens, as the data rooms store all of our IT needs on that campus. NYC Health and Hospitals, Elmhurst, the medical ICU, and the Central Sterile both have completed their new air handler unit projects. These previous units were nearly the end of life, and these new units will ensure that the continuity of service for both of these critical hospital areas. And finally, at Harlem, the Martin Luther King building on the 15th floor, a critical care unit renovation, reached its conclusion. This project provided much needed upgrades to units, including the HVAC system, new isolation rooms, telescopic rooms, new flooring, electrical upgrades, plumbing upgrades, dialysis upgrades, medical gas upgrades, nurse call upgrades, new patient monitor cameras, and TVs. The overhaul of the unit will provide a better environment for our patients and staff. A lot of upgrades to that unit.
Any questions from committee members? Okay, let's move to the resolutions. Manny?
Okay. This is authorizing New York City Health and Hospitals to execute a design-build contract with Bar and Bar to undertake the renovation and construction of the RISE Recovery Integrated Support Empowerment Program Center at New York City Health and Hospitals Lincoln for a contract amount of $11,183,855 with a 10% contingency of $1,118,386 to bring the total cost not to exceed to $12,302,241 for a duration of 36 months. And with that, I'll hand it over to our Chief of Operations at Lincoln, Michael Rowles.
Good morning, everyone. Thank you for the opportunity to talk about this very important project. So this is a women and child specific program that will focus on pregnant women, children, and adolescents. We are co-locating it together with the Family Substance Abuse Disorder, including other existing programs, including the Lincoln Recovery Center, our Catch and Espert programs. Currently, the Lincoln Family Recovery Center is located at the Belvis location, which is 1.2 miles away from the main hospital campus. This is critical in our ability to provide continuum of care to this very patient-sensitive population as they transition from one program to another, and will be achieved by housing the LRC and the substance abuse disorders within the main Lincoln campus. The central location improves patient and clinic flow and allows for greater success by cutting down multiple locations for patients to travel. This program will also provide services and treatment services 7 days a week, such as rapid opioid treatment, induction services with follow-up care, and the family substance abuse disorder will ensure that New York City Health and Hospitals Lincoln can combine the services for all patients' recovery needs, including brief emergency interventions, active treatment, and maintenance therapies. So one of the drawbacks to having the LRC over at the Belvis location is there's no access to a laboratory, which is vital as many patients are enrolled in court-mandated programs where their regular blood and urine tests are required. And then access to a pharmacy is also essential as most patients require maintenance medications. So this project will take place on the 6th floor of Lincoln Hospital, D Wing. It is about 12,614 square feet. We will be building out new essential services, including brand new exam rooms, consult rooms, daycare, waiting rooms, acupuncture, clean and soiled utility rooms, medication room, administrative offices, conference rooms, staff lounge and lockers, as well as pantry and storage rooms. Any questions?
Any questions from?
So I'll take it over from Mike. Thank you. Next slide. So the procurement, this was being design build. It was procured in two stages, an RFQ and an RFP stage. So, sorry, Jose. Okay. So first, the RFQ was conducted to identify a design build firm that had experience in architectural services, MEP, fire protection, permit filings, CON applications, and construction management in healthcare facilities. After the RFQ phase, an RFP was conducted to the shortlisted vendors to kind of evaluate them based on their approach and methodology, their technical proposals, cost estimates, schedule, and experience completing similar scope of work in healthcare facilities. The RFP phase also included site walkthroughs, collaborative dialogue meetings, and vendor presentation. And each round was reviewed and scored by an established evaluation committee. Next slide. So quick overview of the procurement. In March of 24, CRC gave us approval to issue the public solicitation. In July of 24, an RFQ was posted to City Record and sent directly to 22 vendors. Pre-proposal conference was held. 18 vendors attended. And statement of qualifications were due in August of 24. 5 statements were received. The evaluation committee met in September and reviewed those 5 statements. And in November, 3 vendors were shortlisted and invited to the RFP process. Site walkthroughs were conducted with each vendor and collaborative dialogue meetings as well. And proposals from those 3 vendors were due in February of 25. Each vendor submitted a proposal. Presentations were held with each vendor to review their proposal, and the evaluation committee submitted their final scores in March of 25, and Bar was the highest rated proposer. Next slide. This is the RFQ criteria. The evaluation committee was made up of a number of OFT members, essential Lincoln operational and clinical leadership, and finance and EITS representation as well. Next slide. This is the RFP. Pretty standard criteria for us for an RFP, and similarly, the evaluation committee was made up of a number of leaders from Lincoln and OFD, and also EITS and finance. This is the contract budget. So 11.1 million is the base contract. It has a 10% contingency of 1.1 million for a total not to exceed of approximately 12.3 million. This project is currently funded with New York City Health and Hospitals expense, city capital from the borough president, funding from New York State Assembly member Amanda Septimo, and Speaker Carl Hastie. So the contract duration will be for 36 months. There's a contingency of 10%, which will only be accessed if needed for additional work. Bar is new to H&H, but we are in the process of completing reference checks. So far, 3 of those reference checks have come back positive. We're waiting for responses for 2 more, and we'll update the package for the board meeting once that process is complete. Bar submitted a utilization plan, MWB utilization plan of 41.5%. Slide. This is the detail of the utilization plan. So they have a number of subs they're working with across fire protection, painting, acoustic, abatement services that will help them achieve that 41.5% MWB spend. Slide. And this is the resolution. Thank you, and happy to take any questions.
Any questions?
Thank you. I just had a couple questions. I'm always interested how you guys decide whether to use design build, and so what do you expect to get benefits wise?
So I think from this, I think in design build, what we've seen is really time is the biggest opportunity. There are potential for cost savings, and we hope to achieve those as we get more experience with design build, because it does require a significant upfront investment. But for this project, usually the minimum criteria has to be at least $10 million. That's the level set by the state to allow us to use design build. So that's the first. And then we look for projects where it's kind of like a shell space that we can outfit quickly, and really not in like complex clinical spaces. So this is a shell space at Lincoln. It's for an outpatient program. The space will be outfitted like it's pretty standard clinic with administrative spaces, so it's not complicated. So it makes sense for design build.
But in the sense that the contract is 11 point, that we don't have like a guaranteed maximum price or anything like that.
So no, it's not a GMP, but the goal of design build is to be collaborative, to work. You have all the risk is shifted to the designer and the builder, and you spend a lot of time up front, owner, designer, builder, to try to identify all the potential issues that could happen later on down the road to avoid change orders so that the cost doesn't balloon. However, there's still existing conditions that may come up that because we haven't done surveys earlier on. So for those, there will be additional costs, but we hope to stay close to that 11.1 million.
Right. Okay, good. And the references you're checking.
So they may not have design build experience, but they have CM at risk, which is kind of a similar model where the CM holds all the contracts. So initially, we're a little flexible in terms of the prior requirements. They may not all have design build experience.
Okay. So this will be good to hear how it goes.
I will also say that the architect that is partnered with Bar and Bar is well known to Lincoln and has done quite a bit of work there. They
Oh,
know
great.
it very well. So
So they know
I
the
think that
facility.
gives them a heads up as well too. And quite frankly, Bar and Bar is one of the better builders in New York City and the tri-state area. So.
Great.
I would just add a final point on design build, even though it's relatively new to us, it does encourage a high level of collaboration within the disciplines.
Yeah.
So as designs are coming out early, the folks that are going to live in that space can make some real-time decisions. So we're not doubling back when designs are all done and everything else. So
Great.
we do look for efficiencies there as well.
That's great. I'm glad we have the tool to use. So that's good.
Another tool in our box.
One question on the decanting, is that included in the $11 million contract, or that's additional expense?
Separate. The facility is handling that in-house.
All right, great. Thank you.
I missed the part on what happens to in Belvis, like once you move the services, what happens to the site or the population there?
So we are currently working to relocate those services before this project starts construction. In fact, very soon, probably end of June or beginning of July, we will be moving from Belvis, the LRC, and they will be located on the ground floor in what used to be our old admitting space. And we believe that having them on site, with a laboratory, with pharmacy, and other SUD programs at.
Do you expect it to take a full 3 years, or is that
No.
contingent?
We hope to have this finished within 12 to 18 months.
Oh. That's what I thought.
Okay, any other? Okay, let's take it for a vote. All in favor, please say yes.
Yes.
All say no. Resolution approved. Let's move to the next one, Manny.
Okay. This is authorizing New York City Health and Hospitals to execute a contract with Johnson Controls to provide building management system, preventative maintenance, and repair services at various NYC HHC locations for a contract amount of $12,128,122.89, with a 10% contingency on the preventative maintenance portion of the contract to $548,793.41, to bring the total cost not to exceed to $12,776,916 for an initial term of 3 years with 2 one-year options to extend. A little bit of background. We're looking to procure a vendor for the BMS systems and maintenance and repair throughout the system. The building management systems are installed throughout our facilities and used to control and monitor building mechanical and electrical equipment that includes heating, ventilation, lighting, power systems, fire systems, and security systems. BMS used to optimize energy usage throughout our facilities and provide real-time notification of status, critical systems such as fire dampers, pressure relationships, and humidity controls. JCI has been providing maintenance for BMS systems at 13 facilities. JCI has a proprietary solution in these facilities. BMS was procured through a competitive RFP process. The procurement was approved by CRC June 25th of 2019 and the Board of Directors December 19th of 2019 for an NTE of $15,510,315. The current project spend between 2019 and 2025 is approximately $13,750,000, and $2.5 million in annual PM. The current maintenance contract originally expired on December 31st of 2024 and was extended through June 30th of 2025. The extension value was under $1 million, so consistent with OP 100-5. The agreement extension was approved by supply chain. And with that, I'll hand it over to Menju, who will take us through the procurement.
Sorry, one slide back. Is there a timeline overview? So back in May of 24, we received approval from CRC to issue the RFP to City Record. It was posted to City Record in February of 2025 and sent directly to one vendor. In February 19th, a pre-proposal conference was held. 3 vendors attended. And in March, one proposal was received. Johnson Controls was the highest rated proposer since they were the only proposer. Next slide. This is the contract budget. So the contract is split into PM and repair and replacement. PM is approximately 5.4 million. Repair and replacement is about 5.8. There's an annual material allowance of 100,000 a year for a total of 500,000, and an annual software allowance of 50,000 a year for a total of 250,000. And then there's a 10% contingency, which is only on the PM portion of the contract, not on the repair and replacement, since that's kind of an allowance. We don't know how we'll use that, so there's already enough dollars built in to cover that. So the total value of the contract will be about $12.6 million. So Johnson Controls, the contract will be initially for a base term of 3 years with 2 one-year renewal options. It will be for $12.1 million, not including the 10% contingency, which will only be accessed if needed for additional work. The vendor diversity said MWB goal of 10%, but JCI is self-performing most of the work, actually all of the work, I'm sorry, so they were granted a waiver. Their prior contract, they did have a 12% goal, and they exceeded it with 16.5%. The reason that opportunity doesn't exist is that we've, in the process since the last contract, we've removed some equipment from Johnson Controls and shifted it to more open source to allow us over time to be able to be more competitive in these procurements and not be limited to just JCI. So as a result, the work that they had an MWB opportunity, that work has shrunk. So it's no longer there for this contract. Next slide. This is the vendor performance. It's currently good. Next slide. And this is the resolution. Thank you. And happy to take any questions.
Sorry, so are they really the only potential vendor for us?
So we have over time working with funding we've received from DCAS and other grants, tried to shift away from Johnson Controls and go to some other vendors that offer third-party vendors that can support their systems. But unfortunately, for the majority of our sites, JCI is the only option we have.
Is that because the systems are built by them, or?
It's their systems, their software, and they are the only ones certified. They don't have a program where they can train third-party vendors to support their system. They keep it all in-house.
How long have we been with them?
Since the inception of our buildings.
Longer than we would have liked.
So is there anything we can do to start to not find ourselves in that situation?
We have, I mean, so if we had $1 billion, $1.5 billion, we could do that over like the next 5 years. We could just swap out everything from Johnson Controls to more open source. But we're doing that slowly over time. We started that process about 3 or 4 years ago.
Moved a few things out, yeah.
So if you notice, the value of the contract has gone down because we've shifted some equipment off, and we'll continue to do that as funding opportunities present themselves to allow us to do that.
And our sustainability team as well, led by Omar Kabuk, has been able to achieve DCAS funding to help us open up some platforms so we can move away from the proprietary work.
Oh, good. That's good. I think we should try to focus on that, it sounds like. I was going to ask why the amounts went down, but that explains that.
Yeah, we've had a long history with JCI. Their service has not been the best, so we are definitely trying to shift away from them and get our eggs.
Yeah, monopolies don't usually turn out.
Correct.
It'd be useful to find out more about like these building management systems and how they're used to optimize energy and so on, and how that space, because I would think it has changed a whole lot since the inception of our buildings.
So
Different time.
one of the good things with these systems is that their retrofitting is possible. So the controls and the components may be old, but there's head-end equipment that you can tie into those to kind of modernize them and add functionality to help better manage the system, so we can achieve better performance towards our sustainability goals.
So learning more about how that works, I think, the inner engineer in us makes it interesting. So, but thanks. Any other questions or comments from board members? So let's take it up for the vote. All in favor, please say yes.
Yes.
All say no. Thank you so much.
Thank you very much.
Is there any old or new business to come before the committee? Being none, the meeting is adjourned. Thank you.
This meeting is no longer being recorded.